Okay, welcome to part 3 of care for the psychiatric patient. Let me just pull up the information. Okay, this one. Okay, just a moment. This is part 3 of the care of the psychiatric patient. All right, let me just maximize the screen and see. All right, lesson 40 of 47, addressing comprehension deficits. If your patient is delusional or disoriented, you must address these conditions before providing educational information. You can also attempt to redirect a patient's attention from whatever is distracting them. Scenario. One of your patients, Mr. I, is due for a surgical procedure in approximately 48 hours. Until recently, Mr. I has been calm and relatively docile. Now, he complains about his surroundings and rants. I tell him, I ain't done nothing. I shouldn't be here. But they don't listen. I'm no criminal. I shouldn't be locked up like this. I'm innocent. You should help Mr. I return to a state of lucid understanding and recognition so that he can receive the educational information that he needs for his surgery. Best practices: never argue with patients who have psychiatric disorders. Practice patience. Moreover, try redirecting your patient's thoughts away from delusions. Have patients acknowledge or focus on something real. Question 5. Which of the following responses could you use to help Mr. I regain awareness of his environment? 1. Mr. I, this is a hospital, not a jail. You're in a hospital. We're all here to help you. Mr. I, here's a magazine. This is a hospital, not a jail, and we'd like you to relax with this magazine. Mr. I, if I don't get some cooperation soon, I'm calling in the guards to deal with you. Mr. I realize you think you're in a jail, but it's my pleasure to tell you that you're not in a jail. In fact, you're in a hospital, and we're here to help you. Mr. I, why do you think you're in a jail? Why do you keep saying you're innocent? Why don't you try to calm down and listen to what I have to say? All right, magazine. Okay. Okay, next, involving others. If a patient is not capable of comprehending the information you need to communicate to him or her about surgery, you may consider asking others to be present during your explanations. Depending on your patient's willingness to converse with you, you may find it beneficial to include the following people in your conversations with the patient: patient's family members, patient's surgeon, patient's therapist, patient's physician, other staff members. The presence of others can provide patients with a sense of support. Surgeons and physicians can answer specific questions and show the patient who will be performing the medical procedure. These meetings generally reduce the patient's anxiety as well as build trust and respect between you and the patient. Best practices. If your patient becomes disoriented, You may need to modify your educational approach to provide basic information. If your patient is totally disoriented, you may need to medicate the patient or get help from additional staff. Other health educators. Sometimes a hospital or health agency will employ healthcare education, a person designated to educate patients, families, and staff. You may want to ask the psychiatric nurse, liaison, or consultant for tips that can be useful in teaching your patient about medical procedures and nursing care. Your peers also can often suggest or share thoughts and recommendations for educating patients. Remember that one nurse should be designated as the patient educator for each patient to establish consistency for that patient. This designation increases the trust between a patient and nurse that is required for addressing the patient's issues and concerns. If your patient is to have home care support, arrange for a support person to come to the hospital before the patient is discharged so that home care procedures can be demonstrated. This helps assure your patient that the home care nurse is informed and committed to the patient's care. Question 6. Scenario. Miss M is scheduled for surgery tomorrow. She is withdrawn and is not communicating. What's important to remember about offering information about surgery to Miss M or any patient with a psychiatric disorder? Select the best answer, then select submit. You need not bother patients with information regarding surgical procedures. No. You must proceed according to each patient's ability to accept information. Yes. You must address patients with a strong, steadfast, and authoritative demeanor. No. Your nursing role precludes patient education. This is a task for the physician or staff health educator. You need to educate a patient, of course. Correct. You must proceed according to each patient's ability to accept information. When educating patient about a surgical procedure they are about to undergo, you must proceed according to each patient's ability to accept the information. Question 7. Scenario. Mrs. E is a timid, private individual. Upon discharge, she is to be in the care of a home health care specialist. What should your education session with Mrs. E include? 1. Pamphlets on home health care. 2. The presence of her home care specialist. 3. Her surgeon and family members for support before her surgery. 4. A doll or a mannequin to illustrate surgery and home health care procedures. She's very timid. She needs support. So, what should we give her? Just a moment. This is a timid, private, very private. Upon discharge, she is to be in the care of a home health care specialist. So, what should your educational session? Pamphlets on home health care, presence of a home health specialist, her surgeon, family members for support. Before her surgery, she's gonna be home. The presence of her home health care specialist. Wow. I hope there's rationale behind this. Anyway, that's the answer. Okay, summary. Communication needs of patients with psychiatric disorder. Communication needs of patients with psychiatric disorders. Key takeaways. Your ability to educate patients with psychiatric disorders helps these patients mentally prepare for surgical procedures and can help them in their recovery. Before approaching any patient, it is important that you recognize each patient's ability to accept information about their surgical procedure. Your assessment can also involve determining your patient's ability to carry on a coherent conversation and understand their orientation to time and place. If the patient can converse coherently and appears to be aware of their surroundings, then proceed to educate the patient about the medical procedure. If a patient is delusional or disoriented, attempt to reinforce the reality of the patient's surroundings. Also, attempt to redirect your patient's attention from distractions. It may prove beneficial to involve others in the educational process. You may include patients' family members, patients' surgeons, patients' therapists, physicians, other staff members. Course complete. You have reached the end of this learning activity. To exit this activity and complete additional course requirements. Click exit. Exit course in the upper right corner of this window. Exit course. Very good. What? I clicked exit. Hmm? Oh no. Okay, so I have. What's wrong? Oh no, what's wrong? I have to repeat it. Shucks. Okay, let me just repeat it. Oh no. Wow, I have to repeat everything. It's okay. Psychiatric disorders. I've done it already. Let's just continue. Objectives. I've done this earlier. This is in part 1 and part 2. This is just part 3. I mean, this is part 3. This is the last part. I'll just keep going. Question 1. Builder focus on her needs. I remember answering that earlier. Question 2, establishment of rapport. And then the last answer is establishment of trust. Okay, go on, continue on to time, reason, and empathy. Time management techniques, prepared, flexible, reason. Question 1, question 2, question 3, question 4. I've done it. Okay, empathy, time and reason. Okay, 1, 2, 3. Oh my god. Other health educators. 6. Select the best answer. Scenario, complex home care, physical phone, healthcare specialist. Summary. Course complete. You have reached the end of this learning activity. To exit this activity and complete additional course requirements, click exit course in the upper right corner of this window. References, open. Like, oh, my references here. Reference, citation. All right, that's done. And then, yes. Next is the exam. 9 questions. Oh my god, 9 questions to pass. Score 80%, 8 out of 9 questions. Click complete test at the end to score the test. This is not timed. All right. If a delusional patient insists that the year is an incorrect date, it's important to tell the patient the correct date, use distraction, then reorient the patient to another time to correct him. Delusional, right? So if the patient is delusional, use discretion, then reorient the patient. How I correct? All right. Tell the patient the correct date, use distraction, then reorient the patient to not attempt to correct them. Tell the patient the correct date in order to determine patient comprehension. It's important to assess if the patient knows which of the following is the correct location, the current date, the correct location, the correct date, the correct time. A person with a psychotic disorder that is brief, and returns to normal within a month. Psychotic disorder that is brief and returns to normal within a month meets the criteria in the DSM-5 for brief psychotic disorder, schizoaffective disorder. Psychotic disorder that is brief and turns to normal within a month. What is that? Hmm. Hmm. Okay, just a moment. Ah, that's difficult. Okay, I'll keep answering this. I have to focus. Oh, okay, just a moment. Let me just look for the meaning of disruptive, delusional, schizotypal, delusional, schizoaffective. Hmm. Catatonia, behavior, PDD, disruptive mood, Major depressive disorder, bipolar. Mm, communication, rapport, shocks, where is it? Schizophrenia should have one of the domains, delusion, hallucination, disorganized thinking. Oh, so where is it? Wait, just a moment. For schizophrenia diagnosis, a person should have one or more of the following symptoms in five domains: negative, disorganized, abnormal motor behavior, delusional hallucination. Schizotypal personality begins in early adolescence, is marked by acute discomfort with and reduced capacity to close relationships. Five of five or more of the following. What is order psychotic? Delusional. The hallmark symptom of this disorder is the presence of delusions without marked impairment in areas of function. People with this disorder appear to be quite normal with their presentation to others, except when they present their delusional ideas. Differential diagnosis now excludes those individuals who have other conditions such as obsessive compulsive disorder or body dysmorphic disorder. If the criteria for delusional disorder are not met, but shared beliefs are present, then the diagnosis would be other specified schizophrenia spectrum and other psychotic disorder. Sudden onset of psychotic symptoms with a return to normal baseline behavior within a month is considered to be a brief psychotic disorder. Sudden onset of psychiatric symptoms with a return to normal baseline behavior within a month is considered to be a brief psychotic disorder. If the disorder lasts longer than a month, then another schizophrenia spectrum disorder will be considered, such as schizophreniform disorder or delusional disorder. Both of these disorders share the same diagnostic criteria as schizophrenia, usually differ in terms of duration only. Okay. So if it returned in a month, it's called persistent. Mm, Psychotic symptoms, brief psychotic disorder. So it's called brief psychotic disorder. This 2-year period is persistent depressive disorder. A person with a psychotic disorder that is brief and returns on normal within months is called brief psychotic disorder. In order to determine a patient comprehension, it's important to assess if the patient knows which of the following: correct location, correct data, correct time. If a delusional patient insists that the year is an incorrect date, it's important to attempt to correct do not attempt to correct them. Tell the patient the correct date. I don't know. We'll see. Wow, 100. Congratulations. You got 100 points. Wow, it's my first time to get 100 points. So happy. Thank you. Okie dokes. So what's next? Exit test. Evaluation. Did this continuing education activity meet the learning outcome or objectives? Yes. The activity met my educational needs. The educational material was accurate, current, and useful. The teaching and learning methods, including active learning, were effective. The learning assessment activities were appropriate. The activity content was presented in fair and biased and balanced manner, and plan to change the aspects of practice of further this activity. What changes in your practice are you committed to making after participating in this activity? How will these changes improve patient safety? Knowledge of the different psychiatric knowledge about the different psychiatric conditions is extremely beneficial in helping the patients achieve the appropriate care they need. Just practical problem issue. You have an and education, you need to prepare you to address this problem or issue. I haven't encountered an issue. View my completions. Congratulations. Certificate. Care of a psychiatric patient. Yay, well done, Jen. Okay, that's it for my psychiatric course. Next is elder abuse, what you need to know for administrators and healthcare assistants. Course information. Let's start. And launch course. Elder abuse, what you need to know. I will begin a new recording for this one. Bye bye.